Now we will start this session. I would like to say welcome to you here to listen to this session. I am Sarah Meunier at Inera, and I will just present this session, what we will talk about. Today we have heard a lot of... I'm talking English because we have some Danish representation and international. I'm Swedish otherwise, but today we have heard a lot of international discussions or sessions where we are talking about Nordic cooperation and standards around in Vitalis, and this is another session with cooperation or collaboration between the Nordic countries in the area of tests that we will hear more about here now. And I let you present a little bit more.
Thank you, Sarah. Thank you for giving us a stage for our joint Nordic collaboration, where Inera has been a big part of it. So I'm happy to announce to everybody who pops by here, also you, my dear lady in the beautiful dress behind you, that we are here together today to listen a little bit about why we are trying to do a Nordic test beds collaboration for connected health. And what happens is that for some of you who don't know what is happening, I'm Vice Chair of Personal Connected Health Alliance. We have a little stamp down here where you can hear more about us, but some of you maybe heard this morning that Denmark, Norway, Sweden and Finland have adopted international standards for achieving interoperability to connect devices that people have on their wearables, their bodies, their glucose meters, their blood pressure cuffs, that they can get securely and safely into the healthcare system through either a mobile phone or other kind of hubs and gateways. But to achieve that and to understand the design guidelines made by a lot of companies and organizations around the world, we have today here people from Austria, we have Brian from US, LNI Networks, we have from Norway, we have from Denmark, and we have from Spain, from Salut, actually joining this conference to try to make the first steps to be the first movers of achieving a real personal connected health world, where hospitals finally can step out of their fax and try to get into the Internet of Things world for real, because they totally blew the PC era and the smartphone era. So that's our hope. But how to do that, how to test that, how to get kids with diabetes to be treated from home and not go every day to hospital, to get elderly citizens to be manage their comorbidity diseases, everything like that. We have decided to collaborate on supporting the ministerial adoption in the Nordic countries with a service and test setup where we are collaborating and connecting the test services in Norway, Sweden and Denmark, and hopefully soon Finland. But I will give the word first to you, Sverre Fossen from Norsk Helsenet, to introduce us to what we are doing. So I will give you the mic, and hopefully we have about 32 minutes, or maybe 5 if we can stay a little longer. Grab something to eat if you're hungry, but I will give the mic to you, and if there's any question, we take them in the end, because we have to race through this one.
Thank you. I will be presenting very quickly to keep the time schedule. My name is, as I said, Sverre Fossen. I represent Norsk Helsenet, or Norwegian Health Network, which is a government-owned business responsible for the Norwegian health infrastructure and services. We're quite similar to Inera here in Sweden, Medcom in Denmark, and Kanta in Finland. I will give you a brief introduction on what the Nordic Test Center Task Force have been doing and what our goals are. Afterwards, each member will tell us what they have to offer to the network. And how do I change? Cannot change? No? Yeah, thank you.
Forward, backwards.
Forward, backward. Thank you. A lot of technology has been adopted and are being used in its local environment. The pillbox, the communication service, the vacuum cleaner, or the automatic vacuum cleaner. And many of these technologies are working and are solving problems locally. Most of them are even resulting in better lives and cheaper costs for the citizen and for the society. That is very good. I push and nothing happens. Thank you. All these standalone technologies are isolated contributors to a better and cheaper health and welfare service. The question is, how can we connect all these single products together to a unity larger than the sum of one thing individually? The answer is, as already guessed, connected health. In Norway, we have defined a national architecture for connected health based on continua. Its status is for testing or til utprovning, as you say here. And I push and nothing happens. Yes. Good. To define an architecture, to define a road is, however, not enough. We also need to create an environment for development, integration, testing, a working market, which gives vendors the opportunity to create better products, better integrated products, products that can easily be connected to other products. And of course, make enlightened buyers who ask for these products and who pushes the vendors to create and develop even better products, connected products. The goal is to make each product to have a value that is bigger than it is on its own, and this value is increased by connectivity. Yes. We think the challenge is solved best by helping establish a market for telemedicine, for connected health, that is bigger, larger, and opens up for connectivity and information reuse. We face the fact that Norway, no matter how rich we are a small market. 5 million, a population of 5 million, compared to 25 million in the Nordic countries altogether. We also face the fact that our national architecture, in fact, is an international architecture. With that in mind, it was in our interest to establish a Nordic cooperation, to increase the amount of vendors, the number of customers, number of organizations and institutions willing and able to contribute to the making of a larger market. The Directory for e-Health took initiative to a Nordic Test Center task force involving these organizations. This is the first Nordic cooperation on this type of technology. The vision is to build a bridge between buyer and a vendor. To establish well-working connected mHealth solutions is a hard task, challenging and complex, both technology and organization, always both. We want to hide this complexity. When a municipality is wondering what technology to choose, they shall come to us. We have knowledge on solutions, possibilities, combinations of products and their assets. Thus, we need knowledge about customers, the products, the vendors, the end users, and the underlying infrastructure. We want it to be an easier way for spreading connected health in the Nordic countries. We will focus on functionality, not technology. We will offer a predictable environment for testing of solutions. We will offer interoperability testing for connected health. A customer can have an idea of a combination of products that the vendors haven't thought of. We will offer the possibility to try it out. We want the effects to be easy. Procurements shall be easy for customers, and the demands and claims shall be predictable for vendors. We will be opening up for innovation through plug and play. And we will open up for a Nordic market for mHealth, telemedicine and connected health based on the Norwegian national architecture, which is, as said, rather international, based on continua, as mentioned. We are currently establishing our service portfolio. The coming presentations will, in a more detailed manner, describe what we can offer. And I will begin with myself and what I represent. The very short version, since I spent all my time talking about strategic matters. mHealth and telemedicine must use national infrastructure and be connected to other mHealth or telemedicine products to raise the value beyond the value of the product itself. The Norwegian HealthNet provides an infrastructure which gives the possibility to connect new technology and solutions to established technology, national services and EMRs. Both vendors and customers. Melhus municipality, a small municipality nearby where I live, with a total population of 15,000, or the company Epic, where 190 million patients currently have electronic record, can both connect to our test infrastructure via our gateway. Through this gateway, they can connect or communicate with other users of the infrastructure. This also gives the opportunity to test against national services as a national core journal, our portal solution Helse Norge, similar to Sundet.dk, or the electronic prescription system. We provide a basic test infrastructure to connect products with other products. We have also been challenged and are considering to take a more central part in running this network. Maybe should we facilitate the service center in the future? We will see about that. Thank you.
So, thank you. My name is Peter Förster, and I'm representing Nordic MedTest, one of the actors in this initiative of collaboration regarding testing. Nordic MedTest is a test bed or competence center trying to get a platform for vendors and health and care providers to meet, an arena for them to meet and develop and introduce new innovative solutions in a safe and secure way. We are a small company. We are located in Karlstad, Värmland, Sweden, approximately 30 persons. We are publicly owned and a non-profit approach. We are independent in many ways. We have no stockholders wanting money from us. We don't sell products as solutions of the problems we find when we do testing. We focus on bringing quality-related information for the interessents that could use that information to take informed decision in whatever phase they are. So totally independent, focusing on quality information. Our main part of work so far has been to support as strategic partner to Inera to certify and test the e-health product in the national e-health solutions and quality assure the national e-health platform, both from a certification point of view with the products and for the products, e-health products that need information. We verify the producers of the information and also the consumer of information used in the national e-health services. And we believe in a life cycle view of testing. Testing should be a part from the idea stage to the requirement phase, when you are in the procure phase, etc. You should be thinking and acting with test all the way around to produce the benefits of whatever you are trying to achieve. Our experience is that even if it's quite simple technology or simple functionality, when it comes to its end environment, it becomes rather complex very quickly. So this is an example of the national patient overview in Sweden. It could be any e-health services, but when you see it in its full context, it becomes very complex. And for each line here, it's people that should communicate and interpret the standards and the demands. So there we find it's very important to have an independent test service aside from the architectural one. So when we have a good collaboration ongoing when it comes to architecture, I think this test initiative with the same parts focusing on testing, supporting this architecture is a very good step forward. Because we think that we can create and get this market up and running if we can deliver test services. And you have to have test services from different angles and views for different parties in this total environment. So we said we want to have test services that is accessible, easy accessible, that should be affordable, should not be too expensive for the one that need them. And that should cover all involved parties to get this whole environment up and running and working. And you should have this life cycle support. So I think this initiative that Helsedirektoratet has taken in Norway is a very good start for this Nordic collaboration that we can use not only for the Norwegian demands, but also for the whole Nordic, all involved countries. So we are happy to be a part of this startup phase, and I hope many of you others will join in this work as well. So we are glad to be there. So, Anne-Elisabeth.
Thank you. Next slide. This is Peter. My name is Anne-Elisabeth Ludvigsen. I'm from Norway. I represent Devo team, but I'm also representing the University of Agder. And we have a test lab down south in Norway, in a small town, Grimstad, 25,000 inhabitants. And I will tell you about our test lab I4 Health. We have a test lab established for many years now in an environment on approximately 500 square meter hospital, mini hospital, with a hospital, with a usability lab, with a technical lab, with a nursing home and so on, and also a smart home. And in this lab we have established a framework with standards, based on standards and established test methods. And we have a test lab infrastructure to that. We have also a test panel with real users. A couple of years ago, we improved or evolved this test lab according to Continua. We established a membership with Continua, and we have certified 2 experts in our lab now. One of them is sitting there, Bjørnar Henriksen. So now we are delivering services, advisory services and testing services based on Continua framework. What we see, and as Peter said earlier, it's important to test during the whole life cycle, from the idea and until end of life. It's very important. And to do that, we need to involve the users. So in Grimstad municipality in Grimstad and the whole region, which I showed you earlier, Agder, the lands, the counties, there, we have established a living lab concept. So if you go to the next slide, in this living lab, we have established a user panel. We have a method to handle all the users. There's a lot of contractual or ethical aspects that you need to take care of when you involve the users in their home. But if you do that in a proper way, you are able to test all your products in their home, in the real life, and integrate it with the services provided by the municipalities. And that is very important, because then you get valuable input for your ideas for new products, or to how the product should be developed. So there we have 5 steps. We start with defining the use case, and we involve the users in that at home. We run the technical test, we run a usability test, a user test in the home, and also then scaling up, integrating with the services in the municipalities. So that is a project, and there we have also then involved the whole region in that. But still we need to evolve further on. So next step now is to establish an arena for innovation, where we can invite all of you to come and innovate. And we are happy in a small town, South Norway. We have a rich uncle, and he owns all this area here, and he owns the university buildings. He owns all the buildings. He doesn't own all the companies, but he owns all the buildings. So he wants to develop this area with a lot of labs. He owns the university, and he owns all the buildings for companies, and he rented further on. But he's thinking long term. 2050 is his strategic plan, and he wants to develop this area to a health innovation arena. So now we are establishing I for Health, and we are up here in this white building up here. It's not architecture drawing yet, but there we will build an innovation lab. Next one here. It will consist of a lot of labs for simulating and testing, accessibility lab, usability lab, test homes. It will be patient room, robot lab, Internet of Things, technical test lab, of course. And it should be an arena for innovation within healthcare. And what we take into account here is the quadruple helix. And that is to be able to innovate from and to test from idea to end of life. You need to have an arena where you can cooperate with the public sector, with the citizens, with the research organizations, and with industry. So this will be an arena for everyone here, I think, more or less. Yep, thank you. Brian?
Thank you. Yeah, you'll be changing. Okay, I'll be telling you a little bit about the CoLab Denmark setup, which is also testing some of these interoperability issues, amongst a lot of other things. CoLab Denmark is a collaborative model for public and private development across sectors, and it involves a lot of partners, and we are always seeking to engage with more, especially within this test network that we're having right now. The partners are both public and private companies who has special areas of tests, and for one, which is Delta, where I'm from, is focused a lot on electronic testings, compliance tests of all sorts, and others are focusing more on the organizational testing, testing for new workflows, testing for uptake within the organizations. What makes CoLab Denmark quite unique is that the development is taking place within the everyday environment where the production is running, and that the healthcare experts which are working there, nurses, doctors, physicians, etc., they take place in the development, and we have agreements with a number of hospitals, 5 hospitals in total, and some municipalities where it's care homes. So we have a lot of healthcare professionals that working within this setup to test on devices and to help innovate new solutions. The technical experts are providing the technical advisory and technical tests, including the interoperability tests. This is an overview of where the CoLabs are located. This is a map of the southern Denmark, where you can see there are these 5 hospitals and one central hub, which is the CoLab Plug and Play lab, as we are calling it. And the picture shows how the Plug and Play lab is looking with these. You could call it a dollhouse, but anyway, it explains a home, GP's office, a hospital, and a care home where you could do exercise, and the data is displayed on these screens that are or monitors that are attached to each of the rooms, so you can see the data flow across all the sectors, and you can do role plays, you can do things in this controlled environment, testing it even before it's ready for the market, and make sure that the data flow supports the workflow environments. Yes. Now, for all of these devices that we need in the market to be fully interoperable, We're facing a market where it's very dynamic. We have reduced product lifetime, we have reduced prices, we have increased technology convergence, a lot of focus on home use instead of professional use, and all of this makes it a need to be adaptive, to have an agile mindset, but it also indeedly does put a task up for the buyers, for the procurers, to figure out what should they buy, not to spend all the money on things that are not working within the everyday environments. So this figure is trying to explain that we have on one side the vendors who are putting up some requirements, developing and testing their products, and on the other side we have some healthcare providers who have some needs and they do some testings on the workflows. They are preparing some tenders as well. And then a lot of pilots is taking place, illustrated with these blue lines in the middle. And these pilots are too big today. They're spending too much time on that. And so what we would try to accomplish is actually to kind of leverage the button, so making these pilots a lot smaller, spending less money, figuring out what to buy, and to deal with these new products. But what is really needed from everybody right now is experience from these pilots, experience on needs, what is actually required at the public institutions to buy these stuffs. What kind of products is needed? What kind of protocols should they meet? What are the interoperability requirements, etc. So, and at the end of the day, if we have this common grounds, we would like to put up this certificate to actually put a stamp on it, saying that okay, this is actually working within this environment. It could be the continuous certificate. So, at the end of the day, a vision, a common ground with some certifications, building on each of the sensors, the collection units. Now it's an old term, I know, but and then collection backend managers, repository for data, where we could add some certificates, some certifications on different layers, making sure that these products are actually meeting the needs and requirements of the organization. Thanks. Yeah, and any thoughts that you have, any information on requirements, needs, etc., please find me or my colleague Christopher, who's here, and engage with us, or you could talk to Sverre or Peter and Elisabeth to provide some of the information on what is actually the need in your organizations. Thank you.
I think we all pretty much know each other. Is there any questions among us? Otherwise, we can take it at the wine at the gala dinner. So, thank you so much. Thank you for helping with the slides. Thank you for having this internal class meeting, because I think most of the people left the conference. So, let's have an awesome party tonight, and thank you for good efforts at Nordic Collaboration. Oh, yeah, we have. So tomorrow, anybody who wants free consultancy hours, we have the nerd hour from 9 to 10. Is it 9 to 10? Right here? 9 and 9:45. And afterwards, we will keep our continuous certified experts present here at the conference. So if you have anybody who wants to have free consultancy, it's actually, you can win a prize of, how much is your time price, Brian? What? How much is it if I have to hire you? What do you cost? Is it $2,000 per hour? Because you're the leading standardization expert in the world. So it's a very high price you can win if you can get Brian's attention tomorrow. So, and here we have Qualcomm. Okay, so I will say thank you for today. It was a wonderful day, and I'm very happy to see that we have addressed some of the issues we have just been discussing between 6 member states or 6 health authorities around Europe. And I think we have covered some of the issues that was discussed, and I think we can do more. Thank you so much.